Congratulations! Welcoming a newborn into your life is an incredible experience. It's a time of immense joy, but also one filled with adjustments and learning. Remember, you are not alone. This guide provides practical tips and answers common questions. Let's dive in. You're filled with love and awe, but also fatigue and uncertainty. That's normal. Trust your instincts, listen to your baby's cues, and reach out for support. Embrace the cuddles, cherish the milestones, and savor every moment. Feeding your newborn is a crucial aspect of their growth and development. Whether you choose breastfeeding, formula feeding, or a combination of both, understanding your baby's hunger cues is key. Newborns have tiny tummies, so they need frequent feedings throughout the day and night. Watch for signs of hunger such as rooting, sucking on their hands or fingers, and making lip-smacking noises. Crying is a late sign of hunger, so try to feed your baby before they become overly distressed. If you're breastfeeding, offer both breasts at each feeding to ensure your baby gets a good balance of foremilk and hindmilk. Formula feeding parents should follow the instructions on the formula container carefully. Hold the bottle at a slight angle to prevent your baby from swallowing too much air. Burping your baby frequently during and after feedings can help reduce gas and spit up. Remember, every baby is different, and there's no one-size-fits-all approach to feeding. Pay attention to your baby's cues, consult with your pediatrician for personalized advice, and trust your instincts. Newborn sleep patterns can be quite different from what we're used to as adults. Babies sleep for shorter periods and wake up frequently to feed. Establishing a sleep routine can encourage healthy sleep habits. Create a calming bedtime routine, like a warm bath or a story. Swaddling helps them feel secure and reduces the startle reflex. Expose your baby to natural light to help regulate their circadian rhythm. Patience is key when it comes to newborn sleep. Diapering is another essential aspect of newborn care that you'll become very familiar with. Newborns pee and poop frequently, so be prepared to change diapers multiple times a day. Check your baby's diaper every 2 to 3 hours, or sooner if you notice a strong odor. When changing diapers, always use gentle, fragrance-free wipes or a soft washcloth with warm water. Avoid using harsh soaps or lotions, as these can irritate your baby's delicate skin. Apply a thin layer of diaper rash cream if your baby develops any redness or irritation. To prevent diaper rash, change diapers frequently. Keep the diaper area clean and dry, and allow your baby some diaper-free time to air out their skin. If you notice any signs of a severe diaper rash, such as blisters, bleeding, or a fever, contact your pediatrician right away. Maintaining good diaper hygiene is crucial for your baby's health and comfort. By following these simple tips, you can keep your little one clean, dry, and happy. Section 5. Building bonds, fostering love and connection. Bonding with your newborn is an incredibly special and rewarding experience. It's all about creating a deep and loving connection with your little one through touch, sound, and eye contact. Hold your baby close, skin to skin, as often as possible. This helps regulate their temperature, heart rate, and breathing, while also releasing oxytocin, the love hormone. Talk, sing, and read to your baby, even if they don't understand the words yet. Your voice is familiar and comforting to them. Make eye contact during feedings and diaper changes. This helps establish a sense of trust and security. Engage in gentle play, such as tickling their toes, making funny faces, or moving their arms and legs in a bicycling motion. These interactions stimulate your baby's senses and foster their cognitive and social-emotional development. Remember, bonding is a two-way street. As you spend time with your newborn, you'll learn to interpret their cues and respond to their needs, strengthening the bond between you. Section 6. Health and safety. First, protecting your precious one. Creating a safe and healthy environment for your newborn is paramount. Schedule regular checkups with your pediatrician to monitor your baby's growth, development, and overall well-being. Vaccinations are crucial for protecting your baby from preventable diseases, so follow the recommended immunization schedule provided by your doctor. Baby-proof your home before your little one becomes mobile. Cover electrical outlets, secure furniture to the walls, and keep small objects out of reach. Never leave your baby unattended on a changing table, bed, or other high surface. When traveling in a car, always secure your baby in a rear-facing car seat in the back seat. Choose a car seat that's appropriate for your baby's age, weight, and height, and make sure it's installed correctly. By taking these precautions, you can create a safe and nurturing environment for your newborn to thrive. Section 7, is my baby eating enough? Common concerns about feeding. One of the most common questions new parents have is whether their baby is getting enough to eat. It's natural to worry, but there are several signs that indicate your baby is well fed. Firstly, pay attention to their weight gain. Your pediatrician will monitor your baby's growth at each checkup and let you know if they're on track. Secondly, observe your baby's diaper output. Newborns should have at least 6 wet diapers and several bowel movements per day. The consistency and color of their stool will vary depending on whether they're breastfed or formula-fed. Thirdly, listen to your baby's cues. A well-fed baby will appear content and satisfied after feedings. They'll have periods of alertness and sleepiness throughout the day and night. If you have any concerns about your baby's feeding habits, such as difficulty latching, frequent spit-up, or excessive crying, don't hesitate to consult with your pediatrician or a lactation consultant. Section 8. Why won't my baby sleep? Decoding newborn sleep patterns. Newborn sleep can be a mystery, often leaving parents feeling exhausted and confused. It's important to remember that babies' sleep patterns are different from adults. Newborns sleep for shorter periods, waking frequently to feed, and their sleep cycles aren't yet regulated. To encourage healthy sleep habits, try to establish a consistent bedtime routine. Dim the lights, give your baby a warm bath, read a story, or sing a lullaby. Swaddling can also help newborns feel secure and reduce the startle reflex. During the day, expose your baby to natural light and avoid keeping them in a constantly dark or quiet environment. This will help regulate their circadian rhythm. Remember, patience is key when it comes to newborn sleep. It takes time for babies to develop their sleep-wake cycles. If you have any concerns about your baby's sleep patterns or are experiencing significant sleep deprivation yourself, reach out to your pediatrician for guidance. Section 9. Colic and comforting, soothing a fussy baby. Colic is a term used to describe excessive crying in an otherwise healthy baby. It typically starts in the first few weeks of life and peaks around 6 weeks. While the exact cause of colic is unknown, it's thought to be related to gas, digestive issues, or an immature nervous system. If your baby has colic, you may notice them crying inconsolably for several hours a day, usually in the late afternoon or evening. They may clench their fists, pull their legs up to their tummy, and arch their back. While there's no cure for colic, there are several things you can do to soothe a fussy baby. Try swaddling them, offering a pacifier, giving them a warm bath, or gently rocking them. White noise, such as the sound of a fan or vacuum cleaner, can also be calming. If your baby's crying is excessive or you're concerned about their well-being, consult with your pediatrician to rule out any underlying medical conditions. Section 10. Milestones and marvels. Tracking your baby's development. Watching your newborn grow and develop is an amazing journey filled with milestones and marvels. From their first smile to their first steps, each milestone is a testament to their progress. While every baby develops at their own pace, there are general timelines for when you can expect certain milestones to occur. In the first few months, your baby will learn to focus their eyes, track objects, and recognize your face and voice. They'll start to coo and gurgle, lift their head briefly while lying on their tummy, and grasp objects with their hands. As they get older, they'll roll over, sit up with support, and eventually crawl and walk. They'll babble, say their first words, and begin to understand simple instructions. If you have any concerns about your baby's development or notice any delays, don't hesitate to talk to your pediatrician. Early intervention is crucial for addressing any potential issues. Section 11. Tummy time triumphs. Encouraging healthy development. Tummy time may sound simple, but it plays a crucial role in your baby's physical development. Placing your baby on their tummy for short periods each day helps strengthen their neck, back, and shoulder muscles, preparing them for milestones like rolling over, crawling, and sitting up. Start with just a few minutes of tummy time several times a day, gradually increasing the duration as your baby gets stronger. You can make tummy time more enjoyable by placing toys within their reach or lying down in front of them and making eye contact. Tummy time not only promotes physical development, but also helps prevent flat spots from forming on your baby's head. It's a simple yet effective way to support your baby's growth and development. Remember, every baby is different, and some may take to tummy time more easily than others. Be patient, try different positions and activities, and celebrate your baby's progress, no matter how small.